to another episode of The Radio Vet with Dr. Kelly. We are in our old recording studio, and this is awesome. It's nice to be back. So how are you?
I'm doing well. How are you?
I'm overjoyed because like so much normalcy has suddenly returned in a pretty quick, time.
You're right.
And it's like partial, elation and partial terror. It's just like weird. I was like, well, I didn't think I'd be doing this kind of stuff again. So it's nice. Get your shot, everybody, so we can do more of this. Okay. So Dr. Kelly is going to kind of give us her weekend review. I thought I would give her my weekend review and tell you about my wife's little tiny microscopic puppy Chihuahua that she's had for about 2 months now.
Oh.
And she's been very healthy and happy, although she's she's minute. She's like, they always say thumbnail pictures. She's a thumbnail dog. I mean, she's just so small. Traditional Chihuahua, they call it applehead or whatever. But half of her face blew up this week, inflamed.
Oh.
And she has like little sores all over her body that are kind of like, boiled, like pustulating a little bit. Now, here's the thing. She's totally happy and cool. There's no, she doesn't seem like she's on death's door or anything. And so I'm wondering, our initial non-professional assessment was, is this an allergy?
That's what it sounds like when you say part of her face blew up. I assume you mean swelled up.
Swelled up, yes.
Okay.
Yeah. It was not spontaneous combustion. That would have been a whole other conversation.
Yeah, so we see like acute allergic reactions in dogs if they... we frequently see it if they knock over the garbage can when no one's around and people come home to a dog with a poofed up face and maybe bumps on their body, which are hives.
Yep.
A very
kind of what this is,
temporary
actually.
allergic reaction.
Yeah.
Or it could have been a sting. Because they'll get a similar reaction with a sting.
Yeah, she's not... that is possible. She does not spend a whole lot of time outside. She's too small to be outside. Yeah. She's almost too small to be inside. So she's so tiny.
Where do you keep her?
It's so small. It's unbelievable. Oh my gosh. But yeah, do you think this is something that potentially will right itself, or is it something that we should...
So is the swelling been going on now for days? Because then it's really...
It's like 2 days. It's like day 2 or day 3. They thought, because they were just sort of curious, her food does have eggs in it, and they thought maybe it was the eggs because they were just kind of testing and doing their own little thing. And and they gave her a little egg, and I guess it just sort of... It seemed to make things worse for a little bit, And so... I don't know if an egg allergy is something that dogs have. I don't know. I guess.
Dogs can definitely have food allergy, and they typically do occur more commonly in the very young.
That's where we're at. She's oh my gosh, 5 months, 6 months, something like that. She's pretty minute.
I mean, that's pretty young, but it's certainly possible. More commonly, what we see with food allergies what I believe I see frequently is a dog usually a young adult dog who has a history of chronic loose stool as a puppy and then develops chronically itchy skin problems, all kinds of skin issues, because that's how allergies manifest in dogs, whether it's food or environmental. It's all, almost exclusively skin problems.
Yeah. Okay.
So it's interesting because if it was a very sudden change, like you looked at her and she was normal, and the next time you looked at her, boom, her face is swollen and she's got marks on her body. It sounds more like an acute, hypersensitivity reaction, but while those can take, if they don't get like a steroid injection or a couple doses of an antihistamine, it can take a few days for all of that to completely die down and go away.
And I guess again, everyone would be much more worked up about if if behaviorally she had changed. But she's not. She's playing with her toys. Yeah. She's pestering her sister, which is normal.
The quote unquote nice thing about food allergies in dogs is that they don't tend to be anaphylactic reactions.
Okay.
So it doesn't involve the airway or going into shock or anything like that.
Sure. Well, great. I mean,
so
I told my wife not to panic. I guess when they started to kind of burst and pustulate a little bit, she was kind of like, "Oh my God, this is terrible." But I'm thinking it's just, I don't know. But we'll wait and see. And what's interesting, so 2 wonderful things happened this week. I'm just spearheading the show here. I don't know why. So we signed up on your recommendation. We signed up for pet insurance this week.
Oh, my goodness.
So that was nice. So that felt good. And then, and the other thing is that my wife will be coming to see specifically you, because all that we talked about here is she still wants to run her in. So I think the appointment was made. She called East Town and said, "I need to see Dr. Kelly specifically." So expect my wife.
Okay.
You'll get to meet this microscopic little speck of a dog very soon, I hear. So
we'll see how many ounces she weighs.
Yes. Oh my gosh. We'll. So what's nice is that she'll be part of the show next week if you do a week in review.
We can talk about this problem Chihuahua.
I hope so. So there we are. So anyway, beyond the Messerman family, what's going on in your life?
So some interesting stuff we saw in the past week at work. Let's see. One case of hemorrhagic gastroenteritis, HGE.
Heck.
I know. It sounds terrible, and it's very descriptive.
It is. Every word makes me wince.
Now, there's your average happy, healthy dog who eats something that their system is not used to, and first their stomach gets really upset and they throw up, and then maybe the next day their intestines get upset and they have diarrhea, and the diarrhea can become bloody, but these dogs are usually still eating and have their normal energy and go on their walks and seem to feel fine. Okay.
Yeah.
Those are not dogs with hemorrhagic gastroenteritis. Dogs that have this syndrome that we called HGE for many years, and now, of course, it's been updated to a newer, fancier, probably better name somehow, but all of us that graduated more than 10 years ago don't know the new name.
HGE is so 2010.
We speak the old language. The dogs that have HGE are suddenly very sick dogs, and they have bloody vomit and bloody diarrhea, and they are depressed, they are lethargic, they are sick.
That sounds bad.
It
is
is bad. Yeah. They can get shocky because of it.
Okay.
And so when one of these dogs comes in, we figure out that they have HGE really based on one part of routine blood work, which is their PCV or their hematocrit. What is that? The packed cell volume or their hematocrit. It's basically what percentage of the blood's volume do the red cells take up?
Okay, sure.
Yeah, and it's when one of these dogs comes in, it's really, really, really high.
Okay.
Meaning that they've hyper concentrated their blood. They've lost a lot of the liquid portion of their blood, but the cells are still there.
So what causes this? Good heaven.
Good question. Yeah. I don't think anyone knows what causes
really?
this.
Are we talking genetics? Are we talking?
Oh no, I don't believe so. I don't think that there's any strong breed disposition for this. It seems to be a random event. And the good news is that they get better very quickly, but you have to put them on IV fluids to get better.
Okay, so
they're severely dehydrated. Huh. Yeah, so normally the packed cell volume, or the percentage of the blood's volume that red cells take up in your average healthy dog, is like roughly 32 to 47%. Okay, that's how much of the volume of blood red cells take up. When these dogs come in, it'll be in the 60s or 70s. So it's really, really high concentration.
Jeez.
Rather thick blood, if you will.
Oh my, you're right. Yeah. How much time? I mean, if you notice that your dog is having, is it violent enough that you're just like, oh boy, we're going to go to the ER now?
I think it really scares people when they see blood coming out of both ends. Yeah. So they generally get help.
I panic immediately, that's for sure. Interestingly enough, I think the last time we had any kind of exposure to something like this was when my dog had hookworms once, and both bleeding from both ends. Now, is that related to? Or is that a totally different reaction?
So possibly, if your dog vomited up actual worms, that's more likely roundworms.
Okay.
Roundworms look like spaghetti when they get vomited up.
Okay.
Moving spaghetti.
Fun. This is the horror movie episode of the radio.
So I don't know if that's what you saw, but hookworms are a lot smaller than
Okay.
roundworms. But they absolutely can cause anemia in very tiny dogs who have a heavy load of hookworms because they hook onto the wall of the intestine and suck blood.
Lovely.
Like leeches or
Ooh,
something.
internal leeches. Wow.
People can catch hookworms too.
Right. That's what freaked us out.
Okay.
And we Googled that one. We're just like, okay, this has to stop now. But although again, once the medication came in, it was over in a day. I mean, it was very quick, so that's a good thing. So you had did you have a HG?
Yes.
Okay.
Yes.
Yes. I gotta make sure I get the letters right. You had one this week.
Yeah, and so, just like they do, if you treat them symptomatically and get them on IV fluids, they get better very quickly. And
happy ending for this one.
Yeah,
Great.
For sure.
Okay.
Yeah. So something else I saw that was a little unusual, mainly because of the age of the dog that it occurred in, is a odd, kind of frustrating problem called an elbow hygroma.
Oh, I don't know anything about this.
So these occur in typically large dogs that have some weight behind them, and right over the bony prominence of the elbow, if you can picture a dog sitting sternally, meaning their belly's touching the ground, but they're up on their elbows.
Yep.
Yeah. That's a lot of pressure on those little bony elbow points.
Oh,
okay. And most big dogs develop calluses, these hairless, areas of thickened skin on their elbows.
Absolutely.
Normal calluses.
Yeah, my guy's got that going on. Yeah, absolutely.
Yeah. And once in a while, when a large dog who puts a lot of weight on their elbows when they sit like that doesn't have enough padding under their elbows, they'll get some fluid accumulated there. And sometimes, and this is what happened in my young patient, who's only a 1-year-old beautiful lab. He always lays on his left elbow for some reason. He always leans that way, always. And, he's young and slim, and they have an older dog with a nice orthopedic bed. This guy just lays wherever.
Get off the bathroom tiles. It's not good for your elbows.
But one day, he had some bad luck, and he, was laying on his left elbow callus. He doesn't have one on the right side yet.
Okay.
And he must have laid, just in the right position for just long enough that he caused some pressure necrosis. He caused some tissue just under the skin to die because he laid there long enough and he cut off the blood supply just to that spot where all his weight was concentrated.
Oh, boy. Okay.
And so some tissue actually died under the surface. So his little elbow callus swelled up and got red and angry, and he was very bothered by it. And a few days later, this is what they do. It bursts open and the dead stuff comes out, and then there's a big hole in his elbow.
Oh, good Lord.
A gaping hole.
Oh, that's horrifying.
I know. It is horrifying. It's ugly.
I'm going to stop leaning on my elbows now. I'll tell you that much.
So what these need is pressure relief and time.
Okay.
Yeah. So they ordered him some nice, there are products made for this problem.
Okay, yeah.
And the owners were able to order some, padded elbow covers that go up and over the top of the dog because they have to basically hold each other up from one side to the other. So even though he only needs one on the one side, he has to wear both because that's how they stay up. It's like suspenders.
Looks like he's ready for rollerblading.
Yeah. But in the meantime, because this is an open wound now that's about 1 centimeter deep, showing the sub-Q fat layer.
Oh, my God.
He has to be on antibiotics and an anti-inflammatory, and we get to make a beautiful donut bandage, which is this ring of padded material that goes over the wound and keeps all pressure direct from being directly on the wound at all.
Yeah.
And the bandage itself, because it's on his upper front leg, his upper arm, if you will, has to go up and over and around the other side just to hold that up.
He's got like lederhosen on right now.
He does.
Lord.
He actually does. He has this padded bandage with the donut over the elbow.
Yeah.
And then he's wearing a full bodysuit over it because this guy, not only do you have to have one of those cones on him so that he doesn't rip off the bandage with his mouth.
Do it in like 2 minutes, I'm sure.
He is an expert at using his rear foot on the same side to scratch that elbow.
Oh, no.
So he has to wear a full bodysuit over the bandage.
Dude is like in a truss at this point.
So he has the cone,
I should just dangle him from
the bandage, and the bodysuit.
Oh, this poor dog.
You know, he is a 1-year-old happy lab. He's so happy.
Well,
he honestly, he's not going to be put off by any of this.
Good.
His
That's
spirit
good because
is unmarked by this.
mine would be completely destroyed. I would just grumble to my children all day long.
The hard thing about this situation is that it requires time.
Right.
In order to get better.
And the owners have to, I mean, how much do they have to do when it comes to dressing and redressing and all that sort of stuff?
Hopefully the initial bandage will last until the end of the holiday weekend, and we'll see him Tuesday, and we'll decide if he needs another bandage or if they can just move on to the, fancy padded elbow sleeves that they bought.
Is it out of the realm of possibility to just medicate him for the weekend?
Oh, he's got sedatives. Oh yeah.
Okay. And maybe the owners need one too. As a thought.
Actually, yesterday was young, happy, energetic lab day at work.
Oh,
so the other dog that went home with sedatives was although a whole month ago, spayed female lab who we took her sutures out over a week ago, and her skin was beautifully healed.
Yeah.
Now it's 4 weeks post-surgery, and about 1.5 inches of the front end of her incision opened up again.
Ooh, is she nibbling or something? Or
No,
yanking, or?
no. This was healed skin. I believe what happened is that she had a very deep seroma. A seroma is a fluid accumulation that can happen anytime tissue is disrupted and healing. And it's usually just under the surface with our spay incisions, and we can see them, and we can even drain them if we want to.
Sure.
When they're a little deeper, they can be hard to notice, or perhaps hers formed a little later, maybe after the week of rest and she returned to some activity, after having a week of healing, perhaps that's when it formed if she was a little too active. Anyway, when they drain on their own, that's typically what happens, is a little part of the incision reopens and lets all the fluid out, which is a normal part of the process of healing, but it was a surprise because it's a month after her surgery, so it's pretty late.
Yeah.
At any rate, she had to be stapled and go home on sedatives and another bodysuit.
Oh no. The bodysuit suppliers are wondering what's going on in Mequon this week.
I preferred the cone, but because she went home with a bodysuit from her initial spay surgery, and she ran into a tree and ripped the thing.
Oh, good heavens.
Ripped the suit, not her incision.
Oh, right. Absolutely.
So they had to throw that one away.
Good Lord.
But they wanted to try it again.
You keep talking about these, active dogs, and I chuckle because my dog does nothing. I mean, he sits.
And not all labs are like that. I mean, I have a puppy golden retriever, a different kind of retriever, a Labrador retriever, golden retriever.
Sure, yeah.
Very related breeds. I have a puppy golden who's probably 12 to 14 weeks old right now.
Yeah.
She is so mellow. She's just happy to watch and, be there, and she's not hyper at all. She's great.
Dogs are like a box of chocolates, as Forrest Gump said.
Yeah.
You just don't know what you're going to get.
Yeah, they're not all like that.
Interesting.
But sometimes the young hunting breed dogs are a bit much.
Ready to go. Yeah, my temperament has never been matched with that.
And the hardest part of surgery for them is healing.
The most obnoxious part.
And it's not, I shouldn't say it's healing, it's letting themselves heal. By being restricted.
Not joyfully self-harming.
Yeah.
So, there's another bad little bit. I was a bad pet owner that I am. I introduced one of my one-eyed black cats to television this week, and he loves it.
Huh.
Yeah, he was watching Perry Mason this week.
Huh.
So, I don't know if
this is black and white, I assume.
I guess maybe. Yeah. And he didn't just watch a little. He watched for about 22 minutes. So I'm a little worried that he may actually have an addictive personality. And, it could be convinced to watch game shows, maybe soap operas. I don't know. But he's definitely into legal shows. So anyway, that's the report from the Feline Center.
He'll be in Law and Order next.
That's right. Yeah. He'll know all the lines. So any other little quick niblets from the week? Or are we
definitely diagnosed 2 dogs with hip dysplasia, canine hip dysplasia.
Oh, boy.
One is the typical typical kind of middle-aged dog, and one is younger. So that's the two ways that canine hip dysplasia tends to present itself. One, they have pain when they're young and still growing.
Sure.
And they have trouble getting up from laying down. And they may have a certain odd way that they run. Mm-hmm. Or number two, they make it all the way to middle age, 7, 8, 9 years old, and then they start to show signs of arthritis and pain in the hips. And then we X-ray them and discover you were born with hip dysplasia, but it hasn't been a problem till now.
Is that a breed-specific thing in some ways, or
yes?
Okay,
it is a breed-specific thing in some ways.
In many ways,
it's also affected by nutrition.
Oh, interesting. Okay.
Yeah, when they're puppies, I should say. When they're puppies. Hence the large breed puppy foods that are out there.
Right.
Yes.
Absolutely. Okay. Very good. Very good. Excellent. All right. Well, if there's limping dogs out there, Dr. Kelly's on the job. All right. Well, that's the news from the front lines at Easttown Veterinary over there on Port Washington Road, right? You guys are
That's
right.
correct.
Right next to, we were talking before the show, right next to the Metro Market where Dr. Kelly goes and get lunch.
Yes,
we just found that out.
time.
So, all right. Well, say hi to my Chihuahua and wife if you see her in the next 48 hours, and we'll be back next week with another great show. Thank you so much.
Thank you.